Hi, this is Mackenzie, and this is my clinical reflection video. I'm really grateful for the experience I got to have at Skyridge in mom baby, NICU, labor and delivery, and transition. I believe that I had three particular strengths during this rotation. One of them was my ability to observe and absorb information. One person put it as like being like a duck swimming in water. You look fine on the surface, but like you're paddling to keep up. I believe that I got to learn a lot about one, what I was learning in school in our class, but also two, like I got to learn how to do things in practice. And it made it a lot easier for me to learn. One example is fundal massages or what we use certain medications for, as well as just nursing care during labor and delivery and mom baby especially. I also believe that I was flexible with changing learning environments. One day there wasn't enough spots for all of us student nurses to be in labor and delivery, so I volunteered to be in NICU. And while it wasn't as popping as labor and delivery, I believe I was able to learn some things that I wouldn't have been able to learn otherwise. And I believe that this flexibleness, like it allowed me to see something I wouldn't have seen otherwise. And I believe that the knowledge that I learned the day that I was in the NICU was pivotal to my nursing career because it is something that I potentially see myself doing in the future. Also, I believe that I was able to build trust with patients through compassionate and respectful care. It was very rewarding to see that throughout my shift. I got a lot closer with one of the families, and it made my heart so warm to see like them enjoy like all this joy and love and that they had for one another, but also too like how they invited us in and like it just felt like very centered, patient-centered care, and it was rewarding not only to the nurses, but I believe the family that was in there having a baby as well. I also believe that I had some weaknesses during this rotation. One was lacking confidence in my student nurse abilities, especially during physical assessments. And also, I could be better about advocating for myself. So, my first SMART goal was by the end of my next clinical rotation in nursing school, I will independently and confidently perform three or more core nursing skills. This includes vital signs assessments and giving medications under supervision with support of my preceptor or nurse and reflect on my growth in journal entries and in my clinical evaluation forms after my shifts. And before clinicals, I will review various nursing skills that I may perform, ask for tips before, and ask for feedback after performing the skills. And I will track my comfort level in my notes apps to reflect on the experience and prove to myself that I am learning. Also, to reflect on like a useful tip I learned or just something that like helps me feel more confident in my abilities. My second one was advocating for myself, and I think this goes very hand in hand with the confidence. Um, I believe that. So, my SMART goal was I want to build confidence in advocating for myself by asking the nurses if I can do certain tasks like taking vitals, giving meds, or performing assessments that are safe for me to do so, and at least four times in a shift with the support of my clinical instructor and different nurses to continue to learn, grow, and gain confidence in my abilities by the end of my next clinical rotation. And my specific action plan is just I will advocate for myself and ask if I can take vitals, give meds, or perform these assessments on the patient when it is safe to do so. And I'll try to do it 4 separate times if I'm not presented with an opportunity to be hands-on. When I could be hands-on. And I know both of these things were a weakness because it took one other nurse, the charge nurse, to advocate for me to be able to draw cord blood. And I was like, wow, if I like, all the other opportunities I could have had, if I was just like, hey, could I do that? I think that I would have not only learned a lot more, but gained more confidence in my nursing abilities and also confidence too. Like, I believe that I wasn't all as confident when I gave an MMR vaccine, and I believe that a lot of it has to do with exposure therapy, and I believe in doing that, I will become more confident. And so for my future application, so for my future applications, I learned a lot during this rotation, and I learned how to better absorb the things I was seeing around me. And in observing and absorbing, I was able to learn important skills like how to talk to families and how to respect patients' wishes, even if I disagreed with what they were saying or if it went against medical advice. I believe that you do see a lot of that in medical practice. Also, have a deeper understanding of the importance of communication, education, and empathy and respect. When the nurses took the time to really ensure that the patient and their family's questions were answered and their feelings and wishes were heard, it made all the difference. And it showed me how nursing is beyond just giving medications or procedural things, but building trust and supporting the patient and providing patient-centered care. And I will carry these lessons with me in the future because nursing is more than just the little things and more than just like procedures and stuff. And I know now that the little things can make all the difference. Thank you.